This education video will cover the Adult Goal and Outcome Record Flowsheet. The purpose of the flowsheet is used to document the presence or absence of signs and symptoms of potential problems and summarizes the overall progress and condition of the patient. It compares assessment findings against evidence-based CPGs or clinical practice guidelines and brings both into documentation, and focuses on patients' overall progress toward expected outcomes on the plan of care. We will now discuss access to Flowsheet. Once you choose your patient, you will click on the Flowsheets tab to access your flowsheets. On the left-hand side, under Flowsheet Selection, choose the Adult Goals and Outcomes flowsheet and click on it. We will now discuss documentation requirements. The policy here is referenced for you and states that an evaluation of patient progress toward goals and outcomes will be documented by all disciplines as appropriate. The RN will document progress towards goals and outcomes once a shift. We will now return to the flowsheet. Once you have accessed the flowsheet, in order to document, you will need to add a time column. Right-click, choose Add Single Time Column, ensure the date and time is correct and documenting in real time, and then choose OK. From here, we will document to the potential problems assessed. The answer to this one is always all because we are always assessing for all potential problems. The next area will be the potential problems present. Here you will need to choose or select which potential problems are actually present. If the answer is none, that is okay. However, you may also choose as many that are actually present and click OK. If there are multiple CPGs that have been added, you may see different fields or parameters to document against, and they may appear a little bit different. Simply document what you see or what is present with the patient within these fields. Once you have documented against what is present or not present, you will need to document the progress. Here, you will document to improving, no change, or declining. The rehab services progress has to do with our TCU department and is not needed for the inpatient side. Document your observation of how the patient is improving, declining, or if there's no change to the goals. Click OK. The next area has to do with your outcome or shift summary. Here, you can use this box to explain or validate why the outcome was chosen and include a short explanation. Some examples are provider or patient perceptions or can be used for a brief shift report. Choose the option of Save once completed. You may access reference data at any point while on this flowsheet by right-clicking on any green parameter. In the menu, choose the Reference Data option, and here you will be able to access the CPG or clinical practice guideline used. Letter A has to do with the Goals and Outcomes flowsheet specifically, and here is where you will document against the signs and symptoms of a listed potential problems that will be absent or manageable. And this concludes our education for today.